Hi, I'm Paul Willemse. I'm an oncological urologist from the Netherlands. I work in Utrecht as an academic urologist. I am an associate of the EU guideline committee in the prostate cancer guideline, and as such involved in OPTIMA. In OPTIMA, I'm a young investigator and will work as a clinician with the data owners and the statisticians and give advice on the clinical questions. I think that in general everybody thinks that big data could resolve a lot of questions we have on the treatment and the knowledge of prostate cancer. But the problem is that big data and artificial intelligence, they can be an opportunity, but it's difficult as well. So for beginning, artificial intelligence still is in a lot of, it's evolving, which means that we don't know all the gaps yet. And that is something I think frightens clinicians as well. But it must give big opportunities because with the collection of all the real-world data we have, for example, from our previous project, Pioneer, there's so much input that it's impossible for clinicians to overlook that and see into that completely on their own. So I think in that way artificial intelligence will help us look through that data and seek for solutions and seek for the questions we have on prostate cancer. There are a lot. It's so I think what we know is only the top of the iceberg. And we already know quite a lot and we go deeper into it. But, for example, only for a small piece on low-risk prostate cancer, we know that we actually don't have to treat that. We see that there's an advantage because you preserve patients from treatment side effects. But for beginning, we actually don't know for sure which specific patient group we can select for this type of treatment. And if we select those patients, how should you include them? How should you follow them up? How frequent should you do that? And over the past 5 years within the Pioneer, we already tried to answer this question, and we set up work packages to look into this, but it remains really difficult to get a good answer. So that's only for one small part on one really specific topic, but it's so broad. And we actually within Pioneer we already set up a lot of questions we wanted to be answered, and we ended up with a list of 56, which are actually still quite broad answers, so we could continue for years. And I believe if OPTIMA is going to be successful, which I really think it will definitely add something up, but it's only the start. I think what we've seen until now is that when you do research and you do research on your own population, in your own region, then you can find things out at a certain level. But we need to combine all the data from all over the world, from all the big clinics, from all the pharma to resolve the questions we still need. And all these databases, they need to be put together, and I think people shouldn't be afraid that we take a walk with them. I think this is the next step in doing research for clinical questions.